Welcome. This is a video explainer on how people in Connecticut are covered for healthcare from the Connecticut Healthcare Explained project. I'm Ellen Andrews, director of the Connecticut Health Policy Project. Insurance coverage does not guarantee access to care. Also important are transportation, available appointments with appropriate providers at hours people can make, culture and language access, sufficient funds to cover copays, deductibles, and other consumer costs. But having coverage and the adequacy of that coverage is critical to staying healthy and being able to access care when you need it. Over half of Connecticut residents are covered by private insurance through their own or a family member's employment. 1 in 8 state residents buys private insurance themselves, either through Access Health CT, our state's health insurance exchange, or through an independent broker, or directly from an insurance company. Because of federal and state insurance subsidies under the Affordable Care Act, many more state residents are covered this way than in the past. 3 in 10 Connecticut residents are covered by Medicaid, the state's program called Husky. There's been significant growth in Husky enrollment going back to the 2008 recession. Then with passage of the Affordable Care Act, also called the ACA, and most recently the COVID pandemic. As COVID winds down, Medicaid members will be re-examined for eligibility, and the numbers are expected to go down. Almost 1 in 5 state residents is covered by the federal Medicare program that covers seniors and people with disabilities. That number has been slowly growing as our population ages. Unfortunately, 1 in 20 Connecticut residents has no coverage at all. While the number of uninsured in Connecticut has declined, it is still more than the population of any Connecticut city or town. Insurance premiums are growing faster than inflation in the rest of the economy, both in Connecticut and in the rest of the country. The percent of Connecticut employers who offer insurance to their employees has been slowly dropping since the recession of 2008-2009. There were concerns that implementation of the Affordable Care Act in 2014 would lead employers to drop coverage for workers because of expanded coverage through Medicaid and subsidized insurance, but it didn't make a difference. How does insurance work? Health insurance covers medical bills, but not all the costs, and not necessarily for all medical services. For Connecticut residents with private insurance, you and possibly your employer pay an insurance company a monthly premium. In return, they cover your medical costs after you pay your share. In private insurance plans, everyone's premiums go into a pool of money. That pool covers the costs of regular care for everyone in the pool and the costs of more expensive care for anyone in the pool who needs it that year. Insurance is there because we never know when we'll need expensive care. It's critical to have a big pool of people so there's enough money to cover the costs for those who need more. Insurers must predict at the start of the year how much care their pool of people will need that year and set premiums accordingly. At least 80 to 85% of your premiums must go to pay medical bills under the Affordable Care Act. If insurers guess wrong, they must refund the excess. Private health insurance pays some medical bills, but not all the costs. How much your insurance costs depends on your plan. Plans vary a great deal in what they cover and what they cost. Consumers and sometimes their employers pay monthly premiums for coverage. You must pay whether or not you use healthcare that month. In addition, consumers may also pay out-of-pocket costs each time they use healthcare services. And there are several different kinds of out-of-pocket costs. Deductibles are a set amount you must spend on medical bills at the beginning of your plan year, typically in January. Connecticut average deductibles in 2020 were $2,295 for single individual coverage and $3,520 for a family plan. You must pay the deductible amount yourself toward medical bills before your insurance plan starts paying. After you reach that deductible, you will likely have to pay a copay, a different kind of out-of-pocket cost, directly to your doctor or hospital each time you access services. The average Connecticut copay in 2020 was $28.77. Your insurer pays the rest of the bill above that amount. Some plans have coinsurance payments, another type of out-of-pocket cost, where you are responsible for a flat percentage of the bill, for instance, 20%. Your insurer pays the other 80% of your bill. Plans can have one or all of these provisions, but most plans do not have all of them: deductibles, copays, and coinsurance. Under the Affordable Care Act, preventive care is exempt from any out-of-pocket costs. Your insurer must cover the entire bill, meaning you do not pay copays or coinsurance on bills for preventive care, and they do not come under your deductible. Unfortunately, out-of-pocket costs are rising much faster than premiums, shifting more costs onto patients. Medicaid and Medicare are often confused. They are both government programs offering coverage for healthcare costs, but they are very different. Medicare is run by the federal government. Medicaid is run by state governments. In our case, it's the Husky program. Medicare is funded only by the federal government. Medicaid is funded jointly by state and federal governments. Medicare covers seniors and people with disabilities. Medicaid covers children, parents, low-income seniors, people with disabilities, and now low-income adults without children. Medicare has no income exclusion. Millionaires can qualify for Medicare. Medicaid, however, does have income qualifications. Medicare coverage is set by the federal government. Coverage services in Medicaid are set by state government. Medicaid, or Husky in Connecticut, income eligibility levels vary considerably in our program, depending on a variety of factors. In 2021, Connecticut's Medicaid program covered just over 1 million state residents. Enrollment grew substantially when Connecticut expanded the program to childless adults in 2014 under the Affordable Care Act, and again with COVID. During the pandemic, many people qualified when they lost their jobs and their incomes dropped. In addition, the federal government increased Medicaid funding level to the state with the condition that the state could not remove anyone from the program during the pandemic. As the pandemic wanes, the Department of Social Services is reassessing Medicaid recipients' eligibility, and the numbers are expected to decline. Income eligibility for Medicaid varies substantially depending on a variety of factors. Medicaid covers a wide range of healthcare services, and Medicaid members are not charged for their care. Services covered under Medicaid include doctor visits, hospital and emergency care, maternity care, nursing home care, prescription drugs, vision and dental care, and mental health and substance use treatment. In Connecticut, the vast majority of Husky members are not charged for their care. While most Connecticut Medicaid members are white, Connecticut Black and Hispanic residents are more likely to be covered in the program. There are slightly more females in Connecticut Medicaid than males, and adults under age 65 make up almost 2 in 3 Medicaid members, while children are about 1 in 3. Seniors are a much smaller proportion at 6%. Who runs Medicaid? The state legislature, together with the governor, sets major policies for the program. Medicaid is run by the state Department of Social Services within broad federal rules. The federal government reimburses the state for about 60% of our Medicaid costs. The federal government sets minimum income level eligibility standards, but the state can go above that minimum. Most states do. Payments to providers or provider payment rates. The federal government reimburses states for at least 50% of the total costs, more for some populations and services, but the states set their rates to pay providers. Services covered. The federal government has a minimum set of basic services that must be covered. States can add optional coverage categories such as prescription drugs, dental care, and eyeglasses, and almost all do. Payment models. These are reform models, then you can look at our reform explainer for more detail on these. But under the federal government must give permission through a waiver or state plan amendment to go beyond the traditional fee-for-service system where providers get paid for each service they provide. However, states generally have wide latitude in trying new payment models. And the federal government has very little role in operating the program. They provide government and reimburse for some of the costs, but states enroll recipients, contract with and pay providers, collect data on quality and spending, and submit those reports to CMS. What are the Medicaid costs? Connecticut's Medicaid program funding is stable now since we switched from managed care organizations in 2012 to focus on managing healthcare. Connecticut Medicaid spending has remained steady while enrollment has expanded significantly. At $8,890 per person in 2018, Connecticut ranks 19th highest among states. Connecticut Medicaid is very efficient. The administrative burden in the program is threefold lower than it is for other state Medicaid programs that still use managed care organizations, and fourfold lower than Connecticut commercial insurance plans. This is likely because, unlike other states, Connecticut Medicaid no longer uses private for-profit insurers to run our program. Medicaid is not the driver of rising state spending. From 2014 to 2020, Medicaid grew about half as much as the rest of the budget and 3 times slower than the state employee medical costs. In 2020, Connecticut spent 25% or a quarter of our general fund state budget on Medicaid. This compares to the average for other states of 29%. How does Medicaid pay providers? Unlike most other states, Connecticut pays most providers a fee for each service that they provide to Husky members. Medicaid pays providers lower rates than Medicare or private insurance. On average, Husky pays 76% of Medicare rates, above the US average of 72%. Connecticut pays primary care providers almost the full Medicare rate. Community health centers are paid substantially higher rates than other Medicaid providers. Moving on to Medicare, which is a different program. Medicare covers almost 1 in 5 Connecticut residents. Seniors make up 88% of Connecticut's Medicare enrollment, and people with disabilities are 12%. Unlike Medicaid, Medicare has no income limit, but 26% of Connecticut Medicare members have incomes below 200% of the federal poverty level, which is $29,160 for a single person and $39,440 for a couple in 2023. Medicare beneficiaries are more likely to be white and female, both in Connecticut and the nation. Unlike Medicaid, Medicare is not free for most members. Medicare is run entirely by the federal government. Traditional Medicare covers most medical care, but doesn't cover vision, dental, or hearing care, and nursing home care is limited. Prescription drugs are covered by separate Medicare Part D plans members can purchase. The new Inflation Reduction Act that passed in 2022 will significantly lower members' drug costs in the future. All but 1% of Connecticut doctors accept Medicare patients. Access to care in Medicare is similar to private insurance coverage. The large majority of members are satisfied with their care and have a regular source of care. Medicare members are a bit less likely to report difficulty paying medical bills than privately insured Americans ages 50 to 64 just before Medicare eligibility. But those cost problems, when they hit members in poor health much harder. Unlike private insurers, Medicare pays providers based on a calculation of what care should cost, adjusted for the severity of patients' conditions. Medicare Advantage is a separate program within Medicare. The eligibility for Medicare Advantage is the same as for traditional Medicare. Members have a choice of traditional Medicare or private insurers through Medicare Advantage. Enrollment in a private Medicare Advantage plan is voluntary for members. They can switch in or out of the plans annually. 56% of Connecticut members choose a private insurance Medicare Advantage plan for their coverage, and that enrollment is growing. The average 2023 Medicare Advantage monthly premium for Connecticut members is $17.66, which is lower than traditional Medicare costs. Connecticut members can choose among 65 different plans, and 18 Connecticut Medicare Advantage plans offer extra benefits, such as no-cost sharing for prescriptions, rewards for healthy behavior, and help with non-medical needs. Almost 2 out of 3 Medicare Advantage members are very satisfied with their plan. However, unlike traditional Medicare, Medicare Advantage beneficiaries generally must use providers who are in their plan's network. The care will not be paid for if they go outside the network. While traditional Medicare employees can access care from any of the 99% of providers who accept Medicare in our state. Also, unlike traditional Medicare, Medicare Advantage plans require prior authorization for many services. Under prior authorization, enrollees must get approval from their insurer before getting a service. If prior authorization is denied, the service is not unlikely to be covered. 13% of Medicare Advantage members have a prior authorization or claim denied. And half of Medicare enrollees would spend more for a 5-day hospital stay in a Medicare Advantage plan than in traditional Medicare. In a complex process, Medicare Advantage plans are paid a set per member per month amount by the federal government to cover care. Historically, Medicare Advantage members have attracted healthier members, boosting their profits, which average 6.5% of total spending. Some people are eligible for both Medicare and Medicaid. Just over 1 in 4 Connecticut Medicare members have incomes that also qualify for Medicaid. They're called dually eligible. Medicaid pays for some or all of their Medicare premiums, depending on their income. Medicaid also covers their dental, vision, and home and community-based care and prescriptions that Medicare doesn't cover. Dually eligible members have more intense healthcare needs, and their total per person costs are considerably higher than for other members. Long-term services and supports, such as nursing homes, are driving those higher costs. Moving from people who don't have any coverage, 1 in 20 Connecticut residents is uninsured, more than the population of any city or town in our state. Connecticut's uninsured are much more likely to have low family incomes, be middle-aged, Hispanic, and far more likely not to be a U.S. citizen. Uninsured rates in our state dropped when Connecticut Medicaid enrollment grew substantially, when we expanded Medicaid under the Affordable Care Act, and again during the COVID pandemic. During the pandemic, many people qualified when they lost their jobs and their incomes dropped. As the pandemic wanes, the Department of Social Services will be reassessing Medicaid recipients' eligibilities starting in 2023, and the rate of uninsured is likely to rise. It's not healthy to be uninsured. Uninsured Americans are 3 times less likely to have had a medical visit in the last year. They are less likely to get regular preventive care and screenings, and when they do access care, they get fewer services. Because they don't have the same access to regular preventive care, they're more likely to be diagnosed at later stages of diseases when problems are harder and more costly to treat. 1 in 4 uninsured Americans has postponed needed care due to cost in the last year, compared with 3% of privately insured Americans and 8% with government plans such as Medicare and Medicaid. 1 in 5 didn't get needed care, and 19% postponed or didn't get a needed prescription drug in the last year due to cost. Over half of Americans who file for bankruptcy cite medical bills as the cause, and a new study found that 1 in 5 U.S. households has medical debt that averages $21,687. Another group that is at risk of being uninsured is undocumented immigrants. It's estimated that there are 120,000 undocumented Connecticut residents, and a large number of them are uninsured. 70% of immigrant adults are employed and paying taxes to support those public programs they are not eligible for. Under federal law, undocumented immigrants are not eligible for Medicaid or the Affordable Care Act health insurance exchange coverage, even without subsidies. Under a new law, Connecticut has joined other states in providing Medicaid coverage to all children, regardless of immigration status, under age 12, and they can keep that coverage until they turn 19 at full state expense. I hope this has helped explain Connecticut's crazy quilt of coverage. For more information, visit our coverage, Medicaid, Medicare, and insurance chapters in CT Healthcare Explained at cthealthexplained.org. Thank you.